The days get shorter and colder. Some people may find themselves struggling with fatigue and serious mood changes. It's called seasonal affective disorder, or SAD, and it's a type of depression that comes and goes with the seasons. It commonly begins in late fall and stays through winter, eventually lifting in the spring or early summer months.
And we have Dr. Partha Nandi joining us to talk about this. How do you know if you have SAD, seasonal affective disorder, or just the winter blah?
It's a great question. So how do I know I'm not having a bad day? So the symptoms of SAD or SAD are the same as those of depression. They can be different and have different severity, but a person would experience fatigue, having difficulty concentrating. And here's the key: you lose interest in the activities you normally enjoy, have thoughts about death or suicide, and have problems with sleep. Now, those with SAD or SAD can also crave and eat more starches and sweets. They often gain weight in the winter and have a pervasively sad mood. People dealing with the winter blues have similar symptoms, but they're mild to moderate, and they don't meet the criteria. It's not persistent. You do enjoy the things that you normally enjoy.
Okay, so for people who think they may have SAD, what should they do?
Yeah, so it's important. Don't self-diagnose, please. SAD is a serious health condition. It can get worse and lead to problems if you don't treat it, but talk to your doctor about the symptoms you're experiencing. If you're diagnosed with SAD, treatment may include light therapy, medications, and talk therapy with a mental health professional. It really works too.
So what are your prescriptions for this?
So what I would say is that there are steps you can take to help reduce the symptoms. So number one, spend as much time in the daylight as possible, right? Go for a walk, even if it's a little bit cold, first thing in the morning, and try sitting by a window. Number two, eat a well-balanced diet. We talk about all the time. It'll give you energy. If you crave sweets, make a dessert with fruit instead of eating cake and cookies. Number three, exercise 5 times a week, 30 minutes a day. Consider a winter sport because it gets you outside during the daylight hours. And lastly, get out and socialize. People connect with friends and family. Social support is very important, even when it's a little darker.
So don't isolate yourself.
That's exactly right. And say it's dark, and
Right, right. So who would you say are the people who are most susceptible to SAD?
This is very interesting. We're talking about this before. Anybody can get SAD, but it's more common in women. And guess what? It's diagnosed 4 times more common than in men. So your risk factors increase if you have relatives with SAD, if you're between the ages of 15 and 55, or you live where winter daylight hours are very short, kind of like a place called Michigan sometimes. Yeah, so that's, those kind of places. Yeah. If you know this happens, watch out, talk to your doctor, and see what you can do.
And embrace winter.
Embrace it.
Yeah.
Yeah, look at that snow and say, I'm going to go out there, but I'm going to
bundle up, get the snowshoes on, go for it.
Exactly.
Thank you, Dr. Nandi.
Hey, my pleasure.
We appreciate it.
Of course.